we're not. Sometimes we get so caught up in one thing that the media sensationalizes, we kind of lose sight of some of the other things that are going on out there. Now, this is possibly our biggest infection control dilemma yet. Although cases of this bacteria infection have been on the rise worldwide for the past 10 years, there is now an alarming spread recently across the United States. To 35 states have reported the outbreak, but there could be more in the states not being required to report it. And that's the thing, is there could be more out there going on, but they are not required to report it. What makes this opportunistic superbug such a nightmare is that it is a carpine resistant, meaning last resort antibiotic resistant. So last resort antibiotic. They've tried everything else and nothing's working, so now we give you the biggest, baddest dude we've got, the last resort antibiotic. And this carpine-resistant Klebsiella pseudomonas, or what they're calling CRKP, Klebsiella pseudomonas, is a strain which is related to E. coli, Salmonella, and is a family of enterobacteriaceae. Now, what do we mean by enterobacteriaceae? They are found inside of the gut. Outside of the gut, they can cause a lethal infection. A major reservoir for infections are the gastrointestinal tract of patients. Catheters, unclean instruments, and hands and hospital personnel. It's zero in the hospital, ICU, long-term care facilities like nursing homes and those with immune-compromised conditions. It is a potentially community-acquired type of pneumonia. Different, not acquired from hospitals, but the bug has an incredible ability to mutate and resist. It does indeed carry a fatality rate between 35 and 50% or more. This is right from the Centers of Disease Control, guys. I'm not making this up. They say, quote, from the Centers of Disease Control, it does indeed carry a fatality rate between 35 to 50% or more. Now, it's being spread in a much faster and rapid situation. It's in 35 states. And some, maybe more, because some states are not required to report. It's kind of scary. As we are just to avoid hospitals and nursing homes to keep from this public threat? No. This is getting to be out of control because there are, right now in Los Angeles, it's going rampant in the hospitals. There's 1,500 people in the hospitals right now, according to this article, that are affected. So the CRKP and other strains of laugh in the face of antibiotics. There is some glimmer of hope. As of 2005, going back to 2005, the EPA registered a chlorine dioxide, or AKA MSS, and MMS, as a disinfectant for MRSA. Pathogens cannot resist it, and it does not harm humans, according to the EPA. But here's what's so funny, is this sodium chlorine dioxide, or what they also use as, it's unlike bleach. It's required in very small concentration, leaves no residue, and it completely breaks down thick cell walls, which is one of the reasons that the superbugs are so resistant, because they get such a thick cell wall. But here's what they found, is that if you breathe it, it kills you. So if you ingest it or you wash with it, you're fine, but don't breathe the vapors because it can die. In 2006, at Purdue University, they found that besides laser detection technology, that a second innovation used this chlorine dioxide gas to kill pathogens on produce. You can see that these superbugs are now being transferred and passed on to food that we're buying and eating, because they're using antibiotics on fruit trees and vegetables and meats and so we're seeing the same thing happen there. So your fresh fruits and vegetables. This will be a large step for the current technology because now they want to take and flush everything with this here chlorine dioxide. It's kind of scary. But here's where we are. It's not clear at this time that if hospitals are rigorously trying to control the bug with this disinfectant they claim that will work for them, let's hope the hospitals and nursing homes and others do not forget life-saving controls. But this chlorine dioxide, or ClO2, has an update. They're saying now that it's available for home use under the name MMS combo. And so you might be able to find it out there. But once again, if inhaled, it can kill you. So be careful of that. The Centers of Disease Control in LA Times reports that superbug has killed 40% of the people it comes in contact with and has hit 35 states and now has been spread throughout California medical facilities. LA Times. A dangerous drug-resistant bacterium has spread to patients in Southern California, according to a study by Los Angeles County public health officials. More than 350 cases of this last resort resistant Klebsiella and Pseudomonas, or CRKP, have been reported in healthcare facilities in Los Angeles County, mostly among elderly patients at skilled nursing home centers, long-term care facilities, according to the study by Dr. Don Tarshia, an immunologist with the Los Angeles County Department of Health. When I look at the states that are having challenges with this, and I talked about the CRE problem several months ago. It has become, before it was in just the eastern states. Now, let me just give you a list of the states where this is taking hold. Alabama, Arizona, Arkansas, California, Colorado, Delaware, Florida, Georgia, Illinois, Indiana, Iowa, Kentucky, Louisiana, Maryland, Massachusetts, Michigan, Minnesota, Mississippi, Missouri, Nebraska, Nevada, New Hampshire, New Jersey, New Mexico, New York, North Carolina, Ohio, Oregon, Pennsylvania, South Carolina. That's where it started, in South Carolina. Tennessee, Texas, Utah, Virginia, West Virginia, Wisconsin, and Wyoming. Those are the states that have reported it. So it makes you stop and wonder, or is it in some of the other states that have not reported? Now, given the importance of this enterobactericide and healthcare associated infections, or what they call HAI, healthcare associated infections, and the extensive antimicrobial resistance found in these strains, all types of this last resort caprine resistant enterobactericide, or CRE, are an important public health problem. Regardless of the mechanism of the resistance in their country or their origin, these bacteria are a normal part of the human flora, of the intestinal flora. The potential for community associated with CRE infections will always exist as long as they keep abusing and using antibiotics. Because what happens is it does not kill the bacteria. All it does is morph the bacteria. In 2007, I started teaching for the very first time openly about cell wall deficient form bacteria, or what we know as L forms. Okay, this is what we're dealing with, is they have used the antibiotics to the point where these bacteria have lost their cell membrane. And what's left? They're not dead. That was the misnomer. Well, if we kill the cell membrane, the bacteria dies. It releases the nucleic acid. Well, what is nucleic acid? DNA. Bacteria DNA. Now they are in nanosize. little teeny particles that can literally go inside. The bacteria DNA can literally go inside of a red blood cell. Once inside of a red blood cell, will go anywhere it wants in your body, even to your brain, because you have to have red blood cells go to the brain to feed the brain. So once again, this is not something that we should be taking lightly. This is something that we should really stop and think about. You know, like I said when I started the call, sometimes we get all bent out of shape and up in arms about something that the media is really publicizing. And we forget about taking care of the back door. The simple things that could get us is not Ebola. It could be something like one of these here bacteria that have become resistant to antibiotics. And now when they become resistant by losing their cell membrane, and the DNA travels throughout the body and it evolves into a superbug, they are 100 times more dangerous. And that's what we have to look at. They become super dangerous, and the mechanism literally that they use goes on and on and on through the body by sending out chemical antigens to attract other bacteria to them. And the Centers of Disease Control have been working with partners to prevent CRE infections, including those caused by the KPC producing organisms, which are the most common type of CRE in the United States. Now the KPC gene, they make Enterobactericide, a bacteria resistant to all beta-lactam carbapenem antibiotics. So they've got to get away from that kind of antibiotic. But they just keep going back to it and trying to do it a little bit different. And it just doesn't work. Now, they are using these here beta-lactam bacteria or antibiotics in all 35 states. And they are associated with a high mortality rate. Up to 40% of the people they use them to try to stop this, they die. And that's what's sad, is because they're just doing the same thing and not getting anywhere. And that's the thing that we need to look at. There has to be a different direction they need to go. So the United States have raised a question about the identification of the CRE mechanism and what's causing it, these bacteria. And they're starting to really crack down on the doctors and the hospitals and the drug companies, and they're trying to get them to do something. And they're trying to put together guidelines to stop them from doing what they're doing that's creating such an outbreak to cause this here drug-resistant infection. You know, we have the MRSA, we have the VRSA. You know, I've been talking about that for years. And now we got the CRE and the KPC. I mean, all these acronyms of all these different diseases that are going on out there. It just really kind of makes you really stand up and really get nervous, because there's so much that's going on out there that we sometimes just sweep under the table because of the sensationalism that we see going on in the news media over a certain virus or whatever is going on. And we need to realize that there is other things that we need to take into consideration. So with all that being said, where does that leave us? What do we do? What should we be looking at, guys? One of the things that I've tried to rely on my whole life is that really get to understand how bacteria, how viruses, how funguses function. Learn about them. Learn what their weaknesses are. That's what this call is about, so that you can have some understanding of what's going on. For example, right now, guys, there's tons of research out there showing that bed bugs carry the superbug MRSA. I mean, you could go to a hotel and it has bed bugs and they bite you and you got MRSA. I mean, this is a kind of, I mean, it's just, we have just used so many drugs over the years that now we're in a bad way. And we need to understand that the further we get away from nature, the greater the disease we're going to have. And we just need to realize that it's time that we, step back and we punt. And we realize how things function. Now, Dr. Lyda Matman, in her book, Cell Wall Deficient Form Stealth Pathogens, she really, really outlines a lot of stuff that helps me understand more and more about how these cell wall deficient forms function. You take, for example, we know that the bacteria loses its cell wall and the nucleic acid goes out. We know that the viruses also lose a cell membrane and they have challenges. But what about fungus? Same thing. Your candida, it morphs, and it actually grows burrowing legs or roots. It burrows right through an organ or right through the intestinal wall or right through whatever and sets up and starts to digest that human body. It's just kind of amazing. And so once we see that and we understand how these doggone little critters that are just trying to survive, we start becoming less and less afraid, less and less worried about what's going to happen out there. And we start taking solace in the thought that there are answers in nature. That's why I wanted to share with you tonight the research just on thyme oil. That's just one. We could spend our next call on a different oil and read as many researches in encapsulated form as I shared with you tonight on oregano or on marjoram. That's what's amazing, is that the plant kingdom has kept itself safe from bacteria, viruses, funguses for the entire time that this earth has been around. So why should we be afraid today? They have been doing this for thousands upon thousands of years. Otherwise, they would be extinct. Plants would be extinct. They had to function and survive. And thus doing, they have become amazing little chemical producing factories that produce a compound that literally inhibits bacteria and viruses and fungus ability to propagate and grow or attach to your immune cells. And that's what you need to really understand. The power behind nature is so amazing. Nature is complex, so we do not have to be. And that's why we here at Be Young have stood so firm in trying to bring to you the best kind of education. Not sensationalism to try to sell a product, but education, true, pure education, to help you understand not only how the body functions, how the plant functions, how you can use the two together to protect yourself. Because you see, as you're using these compounds that we talked about, and I want to go back and revisit those compounds for you. These compounds also boost your immune system. We know that from research. That's nothing new. But let's talk about them again. There's three main classes: sesquiterpenes, monoterpenes, and phenylpropanoids, TSM. When you break them down from their main compounds into their individual compounds, you have a listing of this. And here's what's fun, guys. You could actually start looking up and doing your research and finding these compounds and seeing which oils have these compounds in it. Go to our website and look. Go to, see, this is what makes Be Young Total Health so important for you. Go to your support product line. Go down to the essential oils, click on it. Go over to essential oil, oregano, for example. Go down and click on Certificate of Analysis and see if it has any of the compounds I'm going to read to you. If it does, you become a happy camper. Because that's why we've provided this information for you. Is now we don't have to diagnose, prescribe, or make claims. We share with you the research. You go and look it up and say, interesting, it does have this or does have that. According to the research from Germany or from Iran or from America or from England, wherever, they say that this compound shows this kind of a control. Well, I see that compound in this product. You can draw your conclusion. So let me read this to you again. Compounds including, thymol, camphor, bromol, carbachol, terpenes, pinene, thymines, terpenoids, citrals. Oh, citrals. Let's just stop there. Citral. What oils would have citral? Lemon, orange, grapefruit, lemongrass, bergamot. Whoa, that kind of opens up a few things. And cineols. Well, which oils would have cineols? Not only oregano, but rosemary, ravensara, tea tree. Are you kind of understanding a little bit more? How many have pinene? A pinene, B pinene. Lavender, myrtle, myrrh, frankincense. I mean, I could go on. Carbachol, clove bud, cinnamon bark, thyme. That's what's a camphor, eucalyptus. It's fun. Because, see, when research is done, it opens up a whole world of understanding. And that's why we were so dedicated from the beginning of Be Young, to bring to you the research, to bring to you the training, to bring to you the information. Because I find when people are empowered with information, they make correct decisions. Not sensationalism. Information empowers people to make correct decisions. And so we've tried to stay away from sensationalism. Many times I've had people say, Dana, you need to make a doomsday kit, end of the world kit. Bag it. If you understand the true information, you can make your own doomsday kit. You don't need me to tell you this oil, this oil, this oil, this oil. You can make it up yourself. And how much more powerful is that when you know why you're doing it instead of Dana said to do it? It goes back to the old adage, you can teach someone to fish to feed themselves, or you can give them a fish to feed themselves. The process of helping educate you and giving you the tools where you can find the education teaches you how powerful it is. And so when you put together your kit of whatever you're putting together to protect your family, you know, because you've done the research, you know that these compounds are going to stop the glycoprotein molecule envelope from happening. And so you build your arsenal because research teaches you that. And you can go to the website and pull up the analysis of each essential oil and look at the compounds and know. Guys, the website has become by far one of the most amazing research and training tools for you. If you're not using our new www.beyoungth.com website and spending time in there to put together your package of stuff, you're losing out. Literally, even now, even though I helped put all this together with Ori, and we spent literally thousands of hours working, getting it all put together for you, I still go in there and spend time. There's just so much information, I can't keep it all in my head. So I'll go in there and spend time and read the different researches. Holy cow. There's stuff in there of the past 19 years that I've been teaching about the compounds of essential oils There's stuff in there that I'm still learning. I'm going, holy cow, I wish I'd known this 19 years ago. For example, one of the researches on black cumin protects you against radioactivity. And you can click on it and take you right to PubMed. You can read the whole thing. I didn't know that. I wish I'd known that 19 years ago. That's the power of what we've put together for you with the website. And giving you the information tonight to help you really just kind of see how potentially powerful of a tool you have at your fingertips. That's what you should be sharing with people. Guys, don't take my word for it. Look at this research. Read it. See what you think. That's how you should be sharing this. Stay away from trying to make claims, this will cure you, this will cure you, this will cure you. Get away from that. Take them to the research. Let them read the research. There's where power is. There's where safety is. Because you're not misleading someone. You're not making claims. And that's not what we want to do. We want to stand with complete conviction and power, knowing, just like I said tonight, what this research, that the mechanism of the antiviral protection appears to be related to the same properties found among other studies of interfering with the glycoprotein molecule that lines the envelope that surrounds many of the most virulent viruses. When they read something like that, it's just so much more powerful. It is so much better for you because you're not misleading anyone. So I hope tonight has really helped open your mind, open your heart, and given you some answers, some places where you can go and look so that you can find safety as we move forward in the future with all of the scary challenges that are going on. One last note just to throw out to you. This here came yesterday. China threatens world health by unleashing a wave of superbugs. Whether it's true or not, who knows? But you know what? If you have some answers from tonight's call, guess what? Do you have to run around in fear? No. You don't have to run around in fear because you have some answers. So I hope this has been beneficial for you. Joyce, back to you. It appears we lost Joyce, so thanks for being on the call tonight. We'll see you next week.
All participants are now unmuted. Thank you, Dennis.